Hello, I'm Well-Prepared-kun. Today, let's learn about COVID-19 vaccine questions 1, difference of infection and onset. The doctor taught me a lot of things at the COVID-19 vaccination venue. Doctor, I got vaccinated without any issues. This will now prevent onset. Yes, however, prevent infection as before by thoroughly wearing masks, washing hands, and gargling. Of course. By the way, I think the difference between infection and onset is difficult to understand. I also get confused sometimes. Well then, today I'll explain about infection and onset in detail. Infection is the invasion and proliferation of pathogens such as bacteria and viruses in the body. Onset is the appearance of some kind of symptom due to the infection. It's also called apparent infection. However, the invasion of the body and infection by pathogens do not always lead to symptoms. Being infected without symptoms, a state without an onset, is called inapparent infection, so-called subclinical infection. Whether an infection causes symptoms will depend on the balance between the infectivity of the pathogen and strength of resistance like the immune system. I see. Is it like the image of a mock cavalry battle? The pathogens and immune cells are fighting a cavalry battle, and if there are more survivors in the pathogen team, symptoms appear. On the contrary, if the immune cell team is stronger, it will become an inapparent infection, having no symptoms. Well-Prepared-kun, that's an easily understandable image. That's exactly right. COVID-19 vaccines are shot to prevent onset and may also prevent infection, according to a paper published. It was published in an American medical journal that the higher the severity of COVID-19, the viral load in the body tends to be higher, and people with low viral loads also pass on a smaller amount of viruses to others. In short, the infectivity of people with subclinical infections is lower than people with symptom onset. I see. Well then, there's a possibility that the vaccines prevent not only onset but also infection. It's to protect both yourself and others. I learned a lot. By the way, how effective are COVID-19 vaccines? I'm wondering about its efficacy compared to the flu shot I get every year. I'll explain that in the next episode. Today's precautionary measures. Number 1. Infection is the invasion and proliferation of pathogens such as bacteria and viruses in the body. Onset is the appearance of some kind of symptom due to pathogens after infection. Number 2. COVID-19 vaccines prevent not only onset but may also prevent infection. Be prepared and have no regrets. Welcome to Araba! Let's all take thorough countermeasures against infections.